I came to UCSF's Family Medicine Residency program in 1990, sort of as a refugee from Harvard Medical School, where there is no family medicine department, and where I was one of three who went into family medicine. And here I really found a wonderful community of like-minded individuals, really focused on the health needs of our diverse, underserved immigrant communities, experiencing many upstream social determinants of health that made it difficult for them to made it difficult for them to access the care that they needed. Though I had experiences working in public health prior to medical school, I really didn't think I would be wanting to do anything besides patient care during my residency years. And I can honestly say that becoming a researcher was never a primary goal of mine either. After residency, my main goal was to become the best clinician I could be, and I actually went to work in clinical care over at the Lakeshore Family Medicine practice, faculty practice. Well, actually wasn't at Lakeshore at that time, but I was really focused on doing the full scope of family medicine, attending on the Moffitt Lung medicine wards, doing labor and delivery care, and really being in full-time practice. But gradually, questions started to come up about various things that were happening, what we could be doing better, and just noticing what are things we can do, and sort of being inspired and having opportunities to participate in our faculty development fellowship, and to take, although I didn't have the opportunity to do a formal research fellowship, I was able to take many of the courses of research courses, and I got involved in our practice-based research network. So I would say, my research has always been informed by the experiences and insights of practicing physicians who are caring for diverse communities and patient needs with limited resources. And because of that, if you were to look at my list of publications, you wouldn't really see necessarily a particular focus. It ranges from studies of many different primary care topics, such as cancer screening, smoking cessation, hypertension, diabetes care, but also on the organization of healthcare and the organization of academic institutions that seek to improve healthcare. Research projects that I'm currently engaged in that I am especially passionate about include a major study on the impact of basic universal income and earned income tax credits on cancer-related health outcomes, and another that focuses on developing and evaluating evidence-based cancer screenings in Mexico, which really brings me back to my public health roots, and what originally stimulated my interest in going to medical school. And currently, I think one of the things about being a family medicine researcher is because we have such broad impact, and because of our central role in serving as an ambassador to communities and really making sure that the patient voice is heard in research, that I've had opportunities to be involved in UCSF's Clinical and Translational Science Institute, and including its research infrastructure network, a collaborative research network, and team science programs. And that's been